patients to physical facilities. We're not incentivized to overprescribe either lab tests or medications. However, our doctors, if they see the necessity for this to happen, they will refer you to a facility for what we call as continuity of care. And we'll be able to manage your condition as well via that platform. We are the only telehealth company at the moment to integrate regulated and licensed medicine delivery to Dubai, Sharjah, Abu Dhabi, and very soon to the rest of the UAE. So if you have any of these symptoms that you see on the screen, we recommend that you speak to a doctor first. And not only these symptoms, but this is just an idea about what you can get and what kind of treatment you can get if you have any of these problems. So we can give you full medical advice. We can order lab tests for you, and also we could recommend medications and deliver for conditions such as, or for symptoms. These are not conditions, these are symptoms of conditions. Obviously, it is up to the doctor to ask you questions, and to, there are things that we can do using the phone. Obviously, the phone has front-facing camera and a back-facing camera. You have a feature to upload photos and documents into the app. And these are things that we will discuss in the coming slides. These are just, this is just a quick overview of the features that you get from using the teleconsultation feature or the doctor online feature. You can receive video consultations 7 days a week from 6 a.m. till 10 p.m. It's a little bit shorter on Friday. It's from 9 a.m. till 6 p.m. We provide you with prescription medications, so not just over-the-counter medications, prescription medications such as antibiotics. Obviously, controlled medications, we don't have the regulatory clearance to prescribe those. However, we're working very closely with the Dubai Health Authority to get approval for those very soon. You have full access to a personalized doctor's report, and if you explore, see exactly how you can access those reports. And the thing about this report is that it's not auto-generated. It is typed, and it is written by the doctor. It is a professional report that you will receive minutes after the consultation for your reference. And if the doctor chooses to refer you to a specialist or to any other facility, it will be also for the reference of that facility. Like I mentioned earlier, we integrate medicine delivery. Sick leaves are coming very soon. And obviously sick leaves, there will be some guidelines that will guide the issuing of sick leaves. However, it's a very valuable feature that will be coming very soon. And the languages, or the doctors, speak the following languages: English, Urdu, Hindi, and Arabic. So we cater to a wide demographic. So, I mean, it's pretty straightforward. And in our opinion, it just makes sense, pandemic or not pandemic. Would you rather receive a consultation at your convenience from home or office, or literally anywhere with a stable internet connection? Or would you rather go to a medical facility and maybe wait in line for something that can be easily managed and professionally managed remotely via the Bayzat app and the teleconsultation feature? Now with the pandemic, it's even more important to keep to stay away from medical facilities, not just because you might catch something. It's because we need to play our role in also easing the burden on healthcare facilities. They were and they are still burdened by conditions of COVID-19 and other conditions, and so we should play our role as possible to try to let them focus on the difficult conditions, and if it's a manageable condition over the phone, let the doctor evaluate it and manage it through the Bayzat app. The journey of the patient on the Bayzat app is very straightforward. It's very simple. It's a very intuitive app. You log in with your credentials. You click on Talk to a Doctor Now, and there you are. You are connected with a doctor. So unlike other teleconsultation or telemedical apps where usually you have to register and then book an appointment, and then the doctor calls you back, and usually they don't. From our experience, at least, they don't call you back, if not within hours. This is an on-demand service, which means you get connected to a doctor immediately, and all the doctors are. We'd like to think that you're consulting not just one doctor, but a team of doctors. They have access to your medical records, and they can manage the conditions accordingly. And this is what we call in our profession as continuity of care. And as I mentioned earlier as well, literally minutes after the consultation is over, you will receive a medical report. It's a professionally written medical report that you could use for your reference. You could download the report as a PDF. You can have it on your phone. Obviously, you can print it out. So that's, again, a very good that you have. Today's topic is none other but viruses. So COVID-19, and I'm pretty sure everyone is, some of us are sick literally from COVID-19, and most of us are sick figuratively about hearing about COVID-19, but it's important to remind ourselves that it's not over, and we are still in the midst of a pandemic, and we need to be vigilant. We need to remind ourselves that there are other conditions out there, and one of those conditions is the flu, and the flu season is coming up. It has started in some parts of the world, and here it will start soon. So we need to be prepared, and we need to be able to understand what are the consequences and what can we do to protect ourselves and our loved ones. Let me just give you a brief, very brief history about this. This might be the most boring part of the presentation, but it's also important just to give us a bit of context and about coronaviruses and other viruses. So coronaviruses, they're not new. It's viruses that has existed in the past. They're called corona obviously because, as you can see here, they look like a crown. And there are four common types of coronaviruses that cause the common cold, hence they're common. The types that you can see here are coronavirus OC43, HKU1, 229E, NL63. And these usually cause mild symptoms that we all encounter, and that we will discuss a bit later. And they're usually mild. There's no problem with that. They usually come and the body fights it off. There are 3 human coronaviruses that produce potentially severe symptoms. So if you've heard of SARS-CoV in 2003, which caused the severe acute respiratory syndrome, and maybe MERS-CoV in 2012 that caused the Middle East respiratory syndrome. These two potentially pandemic or epidemic producing viruses were resolved. And then obviously now in 2019, SARS-CoV-2 is still ongoing, and it also causes, or it was codenamed severe acute respiratory syndrome coronavirus 2 because it does cause severe respiratory complications.
Sorry, Dr. Rami, to interrupt you. Your voice is a little choppy. I think you might have something with the mic. If you could just check. Thanks.
Is my voice clear now?
Still a little choppy.
All right. I'm actually not using the mic because when I used the mic, it didn't allow me to. Let me just double check.
Sorry, everybody. Dr. Rami is just signing back in.
Can you hear me now?
Perfect.
Is it better now?
Yeah, perfect.
Okay. I'm not sure where, I mean, the last thing that you guys heard, but I was talking about the coronavirus and the different types of viruses. You will have these slides for your reference later on. But yeah. So the thing that's coming up, or the flu season is coming up, and that's why we need to be prepared. And there are a few kinds of influenza viruses, and the influenza viruses are RNA viruses. They come from a family that's called orthomyxoviruses. That's not important, I think, but the most important thing to know is that the influenza A and B viruses routinely spread in people and are responsible for the flu epidemics each year. Influenza A virus is potentially the most severe, and it has been subdivided into all these kinds. You must have heard, I don't know if people have heard of the A1. The Spanish flu has been discussed a lot in the context of COVID, and we've heard about the swine flu in 2009. There's also the avian flu, which is the H5N1, which was in 2004. And you can see that there are many different types of influenza A virus, and they're potentially, and they've been classified based on the body's response to these viruses. Influenza B, which is again one of the two viruses or one of the two subtypes that infects humans, is less common than influenza A, and it mutates at a rate of 2 to 3 times slower than type A, and therefore it produces, or it can result in better immunity at an earlier stage compared at least to influenza A. Why are we talking about the flu season, as I said, or about the influenza virus? Because it could potentially have an impact on our response to COVID-19, on healthcare facilities' response to COVID-19. The flu season usually starts in the rest of the world in October. Here in the UAE, it starts a little bit, or the rest of the world, it starts maybe mid-September. In the UAE here, it starts late September, early October. And as you can see, the peak of cases worldwide and in the UAE is usually between December and February. So we need to also understand how most viruses spread. These two viruses are very similar in the way they spread. They spread through small droplets from coughing, sneezing, or exhaling. So droplets are what we produce when we do these actions, which is coughing, sneezing, and exhaling. And these droplets can travel for a certain distance in air, and they can land on surfaces at home. That's why, and this is important because this give us an idea, or this gives us an idea on what we can do to prevent the spread of these viruses, not just COVID or not just coronavirus, but also the influenza virus. The high-risk groups are pretty much the same for both. We call the first high-risk group extremes of age. So children that are less than 2 years of age and older individuals that are more than 65 years of age are considered to be a high-risk group because they have potentially weaker immunity compared to other individuals. Other high-risk groups are also healthcare professionals because they are in close contact with sick people, whether they have COVID or not. So they're always exposed. So repeated exposure or high risk or a high exposure to these potential conditions make them also one of the high-risk groups. And weak immune system, so doesn't necessarily, so for any age, if someone is a smoker or if they have hypertension or diabetes or chronic respiratory problems such as asthma, They also fall within this of high-risk groups, and it's important to keep an eye on these groups, and most of the precautions that we're taking nowadays that the governments and healthcare authorities are also taking are to protect these high-risk groups. So how can we, or what does the virus produce? These are the symptoms that both viruses actually produce. You will feel very tired, you will have a fever, you'll have a sore throat, you might have a cough. Usually it's a dry cough. And if it's a productive cough, that could be an allergic reaction versus, let's say, a dry cough. And a dry cough is mostly related to some kind of infection, which is, in this case, a viral infection and a bit of shortness of breath. But how can we tell them apart? COVID-19, as we said, they're very similar. These are the symptoms that are shared between COVID-19 and the flu. But COVID-19 also, it's been reported that it produces loss of taste. The complications for both are the same as that produce lower respiratory complications or lower respiratory infections, otherwise known as pneumonias. COVID-19 obviously produces more severe complications in children. It produces pediatric inflammatory multisystem syndrome. Although these conditions have been very rare, and studies and haven't observed these conditions. In a lot of children. It's been a very small percentage, but they are pretty much a severe complication. And one of the other complications that have been noticed to be produced by COVID-19 are blood clots. And that's why COVID-19 is considered to be a global emergency. It spreads very fast, and it could result in these complications. But let me just emphasize that these complications, as I said, are very rare, and they happen mostly in high-risk groups. One way to differentiate between COVID-19 and influenza. So obviously by clinical picture, just by looking at the symptoms, it's not enough to determine the difference. Obviously, we've all heard of the PCR test. This is a lab test that is done where we collect samples either from nasopharyngeal swabs or nasal swabs, or also from a blood test, and they can determine whether you have COVID-19 or you have the coronavirus, or you're a carrier of the coronavirus. To me, this is a very important part, and it's also a little bit entertaining to hear some of the things that you hear out there, and I feel it's also our responsibility to try to clarify some of them, and just make sure that some of these misconceptions are not circulated because they add to the damage that this pandemic is already causing. So for COVID-19, there are misconceptions that have been circulating since it started, or since the emergency measures have been implemented. So some people have been saying that coronavirus is man-made and that it's been manufactured in a laboratory. This is we absolutely refute this. Health experts all over the world they've refuted this, and they've said that this is actually doesn't even make sense to manufacture a virus that preys or whose victims are actually old people mostly. So this is absolutely a bit preposterous. Home remedies can cure the virus. Again, this is not something that has been scientifically proven, and we operate with evidence, and we operate with evidence-based medicine. And some people, or there's been articles, I'm pretty sure we've all stumbled on those articles that say that you could mix garlic with hot water, and this will kill the virus, or you can ingest an antiseptic. Again, these are all things that shouldn't be done. I mean, natural remedies, so fresh fruits, fresh vegetables, vitamin C, these are all things that will help boost your immunity and keep you healthy, but they will not kill the virus, they will not cure you. We will discuss what are the measures that we can absolutely take to prevent spread of the virus. Holding your breath for 10 seconds means you're virus free. Again, some people have circulated that this can replace the PCR test and can tell if you do have the virus or not. This is absolutely not true. So please do not try these. Whatever exercises you see on YouTube or other websites, please do not try them. There are exercises out there, but they have to be done with professional supervision and under medical supervision. There's been also circulation of theories that heat might kill the virus in different ways. So it's been hypothesized that when the summer comes, the spread of the virus will halt or will decrease because of the heat. Even though this might be true in some parts of the world, but it's not directly related to the heat. It could be related to people's behavior when it comes to the hot weather. People are spending more time indoors. They're spending less time outdoors because of how hot it is outside, but heat itself doesn't kill the virus. And hence also measures such as using ultraviolet rays over your skin or using a hair dryer. We've seen people actually who've called us and asked us, can I use a hair dryer or an air dryer to kill the virus or to disinfect my hands or to disinfect my face? Absolutely not. These might cause damage to your skin. So just stick to, soap and water and hand sanitizers for your skin. Ingesting alcohol obviously doesn't kill the virus. Ingesting alcohol or ingesting bleach or ingesting any product that has been marketed or publicly announced to kill the virus, there is no product out there that kills the coronavirus, scientifically proven. There are studies and there are reputable organizations that are working on a vaccine to prevent the spread of the virus, but there are no products that actually treat or deactivate the virus. Kids can't get the coronavirus, although it has been true that kids usually don't suffer from serious complications, even though we discussed earlier, pediatric multi-system inflammatory syndrome. It's a very rare complication. So kids do carry the virus, and kids actually play a very big role in transmitting the virus. We are fortunate that our kids don't suffer from the complications. However, they are very active carriers of the virus and can transmit it to other vulnerable groups, such as old people or people who are already sick. It's been also circulated that this is a fatal virus. That's not true. 84% so far, 84% of people who get the virus will have mild, and the mortality rate to date is about 4% of whoever gets the virus. Even though 4% might seem like a small number, it is an important number, and that's why this is our job as healthcare professionals, is to avoid mortality at all. It shouldn't be 4%, it shouldn't be 3%, it shouldn't be 1%, it should be 0%, and that's why we're taking all these measures. Also, the last one is that you don't need masks, and there's lots of studies on the efficiency of not just masks, but also distancing. So the best way to prevent spreading the virus is not to spread the virus. And how you can do that is by using barriers. Masks are one of the ways to use barriers. Obviously, conspiracy theorists just, discuss that, it's been a conspiracy by mask companies or by companies that produce disposable masks, even though the CDC and the World Health Organization have clearly put out regulations on how you can fashion your own mask, which is a cloth. Answers that question maybe, but masks are absolutely important, and in the UAE, if you don't wear a mask in public, you get fined. There are also some misconceptions when it comes to the influenza virus, is that if you take the vaccine, you get sick. That's not true. There are two types of vaccines for the influenza virus. One of them is inactivated and the other is a weak virus. You might get some symptoms after being administered the virus, but you don't actually get the flu. Healthy people don't need to be vaccinated. That might be true for young individuals. It used to be optional to take the vaccine because only high-risk groups, it was recommended for high-risk groups to absolutely take the vaccine, but younger individuals, it was optional. However, as we said, because of the impact of COVID-19 and the potential impact it could have not just on these healthy individuals, but on the rest of other high-risk groups, it is absolutely recommended for everyone. If they have the option to take the influenza vaccine, they should take it as soon as it's released. Getting the flu vaccination is all you need to protect yourself from the flu. That again, there's a bit of that's an incomplete fact. It's not completely wrong, but it's an incomplete fact. You need to take other precautions, and we didn't need you don't need a global pandemic to know that keeping your hands clean and keeping your surfaces clean and personal hygiene is important. We don't need a global pandemic to remind people about that, but now it's even more important than before. The flu is just a bad cold. That's not true. Influenza is a virus. It can cause potentially serious complications in high-risk groups and other people. So it's not just a bad cold. It's a separate entity and potentially severe complications. You can't spread the flu if you're feeling well. That is not true for both viruses, whether it's COVID-19 or influenza. A lot of asymptomatic, which means people who don't express any symptoms, especially young children, a lot of them are active transmitters of the virus. That's why everyone needs to wear a mask, whether you feel sick or not, whether you think you're very healthy or not. And you can spread not just the coronavirus, but also the influenza virus. You don't need to get the flu shot every year. The flu shot gets released every year because this virus mutates, which means its configuration or its backbone or its structure changes every year. That's why there's a new virus, there's a new vaccine every year for this virus, and it's important for high-risk groups to take it every year. It's mandatory, and in the context of the current pandemic, it's very strongly recommended for everyone. You have a high fever with a flu that lasts more than a day or two, antibiotics may be necessary. Of course, this is absolutely wrong. Antibiotics are medications that we give for bacterial infections. So if you have a bacteria, we give you antibiotics. If you have a virus, there are some viruses that can be given antiviral medications, such as the Tamiflu. I'm sure some of you have heard of Tamiflu, but when you have a virus, you don't take antibiotics. That is absolutely wrong. Even if you have a fever, you don't take an antibiotic. And if you're confused, if you think your symptoms, if you do have any symptoms, you actually should consult a professional, whether you're well-read or not. That's why we've made it easier through the Bayzat app and the TELECONSULTATION features that we have on it. If you have any other condition as well, you should use the app to consult a doctor and seek a professional opinion. So what can we do? These are just, we will discuss, the things that we can do are general, and it's not a secret. Is. And this is how COVID-19, when it comes to COVID-19, this is how fast it spreads. It has something that we call the reproduction number, which is very high. It's about 2, which means each individual can transmit the virus to about if you don't take any precaution, each individual can transmit it to about 2 to 3 people. So as you can see, it's an exponential increase, and that's how it has turned into a global pandemic. But what if we exercise social distancing? So if this person worked from home, as you can see, the number dramatically falls. If this person doesn't go to a barbecue, it falls even more. If this person doesn't fly domestically, or if this person worked from home. These are all measures that we can do, and actually, I don't condone the term social distancing. I prefer the term physical distancing because we need to be socially connected with our families and with our friends, and we have digital tools to help us. We're using one of them now, and you have one of those actually to also connect to a doctor, which is the Bayzat app. Discussed how there are people out there who are actually, there are some countries now that there are protests against masks, but the science is very clear, and it's very, it doesn't need a rocket scientist to know the value of masks. As you can see on the left, this is an infected individual, and this is what they can do. And this is what they can produce. These are the droplets that they produce. They vary in size and they vary in number. But if they wear a mask and so the sick person, the size of the droplets decreases and the number decreases. And from the sick person and for the healthy person, it's even less exposure. So this is just a very simple representation, but the studies on this have been ongoing, and the value is very high of wearing masks. There are also some other precautions that we can take. So if you're going back to the office, you need to also exercise some of. We've used the Dubai Chamber of Commerce to share these recommendations. If you're using public transport, try to maintain a safe distance from other travelers. So usually it's around 2 meters. If you're using your own car, wear a mask, sanitize, the door handle, the steering wheel. Try to carry an alcohol-based hand sanitizer at all times. Once you reach the office, you can discard the gloves and the mask in a designated bin, and your office should provide those. In the central hub, masks and gloves will be available. I mean, this is for the Dubai Chamber, but your office should also provide that. Maintain 2 meters from your colleagues, and strictly follow the procedures that are outlined. When it comes to your breaks, or when it comes to having a meal, also maintain your distance. It has been recommended to have a certain capacity, which is about 50% in common areas, and try to use digital tools we're using now, or also the Bayzat app when you have a medical problem, or when you have other problems. There's lots of features on the Bayzat app, not problems, but when you have other requirements, you can use the Bayzat app. Going back to school has also been, I'm pretty sure it's on parents' minds and on everyone's minds, and it's important to be very careful. The guidelines when it comes to going to schools differ from one educational entity to another, or from one school to another, but the general guidelines and the general recommendations remain the same. What you can do is that you can talk to your children, and you can tell them about the changes that are expected this year. They might not fully understand why they're required to distance learn, or their class is missing a few of their classmates. So you need to try to explain it to them in a language, obviously, that they will understand. You need to emphasize that they need to keep their hands clean, wear masks, and obviously this will be supervised by teachers and other personnel in those schools. At home, you have to monitor your kids daily, so try to measure their temperature. We recommend measuring your own and your kids' temperature at least 3 times a day. So once in the morning, once in the evening, once in the afternoon, once in the evening, and check for symptoms. The symptoms that we mentioned earlier, which are obviously a fever, cough, shortness of breath, unexplained fatigue, loss of taste and smell. I mean, loss of taste and smell doesn't necessarily mean you have the coronavirus, but if you have any of these symptoms, what we strongly recommend is that you seek professional advice. And before you take any step, before you think of stepping outside of the house, or before you think of giving your child Panadol or any medication, we recommend that you speak to a doctor first, again, through the Bayzat app. These are just, again, some of the other measures that kids and remember, wash your hands before going into the bathroom, before handling food. Soap and water is the best way to wash your hands. You can remind your kids that when they're sneezing, they need to use a flexed elbow. Remind them not to share food with their classmates. Remind them to try to keep their distance when they're greeting their friends, and also keep their distance from their teachers. And obviously the teachers will exercise that, but when it comes to children and how they deal with each other, we need to try to remind them to try to keep their distance as possible. So just to recap, these are, again, the recommendations of the World Health Organization. And these are general, whether it's at home, in the office, at school. As you can see, they still are the same. Personal hygiene, social distancing, and last but not least, and this is a recommendation by the World Health Organization, is that if you have any symptoms, remote teleconsultations or remote applications or digital applications that you have, and again, that is provided by the Bayzat app. I'm just going back to this slide just to tell you what the last added measure that we can do is we can take the vaccine. All of us can take the influenza vaccine as soon as it's released. The UAE, it's usually released late September, early October. So as soon as it's released, it is recommended for everyone to take it this year. High-risk groups, absolutely recommended. So the government will probably also lay out a plan, a priority plan. High-risk groups will take it first, and then the rest of the groups will take it later. Thank you, everyone. We apologize for the technical difficulties that we had initially. If anyone has any questions, they can type it in the chat box, and I'll be very happy to answer them.
Dr. Rami, what is the view with, I guess, working out, exercising while maybe not having the flu but the cold? I mean, does it help you recover? I've heard mixed reviews about that.
So again, if you're sick or if you have any symptoms, again, we recommend that you speak to a doctor, because it's not one size that fits all. But in general, if you do have a sickness, if you have a confirmed sickness, if you have a confirmed viral infection, whether it's coronavirus or otherwise, it's better to stay at home. You don't need to rest completely, which means you don't need to lay in bed all day. You need to do, so when it comes to coronavirus, you isolate yourself in a room on your own, but try to keep active indoors. Try to do a mild or low intensity exercise, at least for about 20 to 30 minutes every day. When it comes to the influenza, the same is recommended. But obviously you need to keep your distance, so don't go to a shared space such as a gym. Try to exercise if you have the influenza. If you don't have the coronavirus, try to exercise outdoors, but like I said, a very mild intensity. Could be jogging, could be walking at a brisk pace, or it could be cycling, but no heavy lifting, no high intensity exercises, no physical sports. Other measures obviously include hydrating as much as possible, and maybe some supportive medications. But like I said, this will be determined by a doctor if you choose to speak to them about that condition.
Great, thank you.
Mm-hmm.
I don't see any more questions. So I have one more, and then we'll see if there's anybody else that will pick up or not. But as a leader in telemedicine, how have you seen telehealth kind of evolve over the last few years? And what do you think the future for telehealth looks like?
So telemedicine is not new, actually. It's been around in different forms. So historically, it's been around. So basically, if you just speak to a doctor over the phone, that's considered to be telemedicine. But it has evolved in the last 10 years, and it has evolved to become a cost-saving measure for healthcare facilities, for governments, for companies, but also now with the advent of communication and the advances that we have in communication. I'm pretty sure everyone now owns a smartphone. Everyone now has access to the internet. It has become convenient. And then, so at first it was necessary, and then it became convenient, and then it became necessary again in the context of the pandemic of COVID-19. Like I said, we've been around since 2016. I've been in the field since 2013. There are guidelines for safe and very efficient management of conditions remotely, because we understand that before the pandemic, that people were a little bit skeptical, they were a little bit hesitant on using such a service. But when people try it, we find that they're very happy with it. Conditions maybe such as mothers who have children, people who are working from home, and they just need advice or quick reassurance, or even a more detailed plan. And like I said, applications and platforms that are really advanced, such as Bayzat and otherwise, make this very convenient to the patient or to the user. We don't like to use the word patient because you don't need to use the app only if you're sick. If you have general advice on improving the quality of your life or on other measures, you could again use the app. So yeah, we find we truly believe in the mission that we're doing, and we find that we add a great value to healthcare facilities and to governments and to even companies and employers. So we have a question here also from Sayed. In which month should we take the flu shot here in Dubai? So as I mentioned earlier, the flu shot it's usually released late September, early October, and the Dubai Health Authority will announce it as soon as it's released, but it is recommended to be taken as soon as it's released. You can take it anytime, actually, during the flu season. It will still give you protection, but obviously the earlier the better, because as you can see, as you saw in one of the slides, is that it gets more serious and it gets more severe in the months between December and February, which are the coldest months, and it is recommended to try to take it before those months, but if you take it during those months, it's fine. So just simply put, as soon as the vaccine is released, you should take it.
Yvonne, I see you raised your hand. I don't know if you could chat right in the chat group.
I guess you could unmute your mic and ask the question if you want to, or you could post your question in the chat box. Okay.
Okay, well,
Kelly's asking
for the questions.
Yeah, so
Oh, go
Kelly,
ahead. Sorry.
yeah, Kelly's asked a question in the Q&A. She's asking if they can get a copy of the recording sent to them to share with their colleagues.
I guess this is a question for Brian.
Yeah, of course.
Yeah.
Absolutely.
Yeah.
We'll send across the recording.
All right, perfect. Yeah, Kelly's on here as well, so I hope she got that. Perfect. We're happy to help Kelly.
Thank you very much, Dr. Rami, for the insightful presentation. And thank you everybody else for attending the session. Hopefully you guys found it useful and insightful.
All right. Thank you, everyone. Take care and stay safe, and enjoy the rest of your evening.
All right.
Take
Thanks
care,
everyone
everybody.
for attending. Thanks, Dr. Rami.
Thank you.